This is Mission Sonlight Extra. This is part 2 of a 2-part series.
Since we came back from Greece, we have continued to stay in touch with the doctors from Adventist Help, which is the organization that runs the medical clinics in the refugee camps. And as a result, I've gone back to other locations of refugee camps where Adventist Help has branched out and is now connected with ADRA. One of the new projects is the very first in the world ADRA field hospital, which is now built. There's an emergency unit and a primary care facility in one of the refugee camps where there are more than 100,000 refugees in northern Iraq. This is one of the new areas that has very little in medical care. This is an area where babies die every single day from preventable conditions, preventable diseases, but simply without enough medical care. And after returning from Greece just this last summer, I went with 2 of my friends who have the same passion for refugee work, and we did needs assessment for ongoing volunteer staffing at the ADRA field hospital where Adventist Help is running the medical clinics. As a result of this, we've started our own organization, entirely volunteer run, called Exilio Projects, which is focused on helping to connect volunteer medical staff with positions that are needed, either short-term or long-term, to serve in the refugee camps in volunteer medical work in one of the most high needs populations in the planet right now. When we traveled to Greece, that was where the primary emphasis on refugee work was taking place. But since then, the needs, while there are still many refugees in Greece, their needs are being much more well provided for, and the intense needs are now more in areas like northern Iraq and Kurdistan. So there's been a shift in focus in our in-country partners to away from Greece, where it is more stable, and into northern Iraq and Kurdistan, around the area of Erbil. So just a few months ago, we went back to do needs assessment in these new refugee camps in northern Iraq, behind the Kurdish lines, where it is a very safe and stable zone. But there are an incredible number, hundreds of thousands of refugees without stable medical care, without emergency care, without prenatal care, without pediatric care. One of the things that has given the ADRA Field Hospital and Adventist Help such an edge in this area for funding from huge worldwide organizations is that these 2 ministries, ADRA and Adventist Help, are entirely volunteer run. They aren't paying huge NGO salaries to people from other countries. And so they are able to staff and fill medical positions in the emergency center and the primary care hospital for far less budget than many of the other organizations that would bring in Western professionals expecting Western salaries in these very high needs areas. What my friends and I do now is help to recruit medical staff who have really big hearts, who want to go either in a big group intervention, like to do a huge dental clinic for hundreds of people in a week, or thousands of people, depending on the situation, and also medical staff who may want to spend their vacation time or take a summer or 30 days and go and give back out of their free time as volunteers. So there are a lot of ways that people in the West can get involved. We have had volunteers in the emergency center, in the primary care facility from countries all over the world who have medical experience and want to be part of serving as volunteers one of the most vulnerable populations in the world right now. If you are someone who is an experienced medical professional, a physician's assistant, an EMT, a nurse, a psychiatrist, a psychologist, a doctor, anyone in these areas of expertise, and you have a desire to be of service, to give back, whether it's for 2 weeks or 6 months. There are needs in all of those time frames, and we are working to connect the dots between those open volunteer positions and the people who have the experience and the passion to serve, and help put those together to create ongoing volunteer teams in the refugee camps to serve these people. If you'd like to find out more, you can search for us on Facebook at Exilio Projects, that's EXILIO, Exilio Projects, or online at exilioprojects.org. That's www.exilioprojects.org. My team and I at Exilio Projects, as well as the doctors and the support staff in ADRA Iraq and Adventist Help, would like to extend our heartfelt thanks to Mission Sonlight, to the Mission Sonlight viewers, and to your mission-minded hearts that are listening to this story and thinking of ways that you can pray for us, that you can support the work of refugee camps, that you can either volunteer or give, or simply ask God to continue providing what is needed. Your prayers, your thoughts, and your support mean the world to those of us who are seeking to make a difference on the ground. Thank you.
Thank you for joining us for this Mission Sonlight Extra.